Forum last week, co-sponsored by the Island Guardian. The San Juan Islander has posed 8 questions for the 6 hospital candidates and has published their answers. And I'm sure you've been following all the letters to the editor in the journal. Now it is the League's turn to give the candidates a chance to present their cases and answer your questions. And if you feel you still have questions about the candidates, the League has a great election website where candidates were invited to answer questions posed by your local League members. If you go to it, vote411.org, and that's VOTE411.org, we think you'll find it of interest. And Tom Muncy is here tonight to videotape our forum, so if you want to recommend it to your friends who could not be here tonight, they can watch us all on YouTube. And now I'm going to turn the forum over to our hardworking voter services chair, Steve Bowman.
Thank you, Claire. So it's going to be a very busy evening, so I'd like to get underway right away. But first, I'd like to ask everyone who's got a cell phone or any other electronic gadget to please turn it off. Serenaded by cell phone chirps and beeps is probably not what the candidates are after tonight. So our first race tonight is the San Juan Island School District number 1, School Board Director number 4, which is a 4-year term. Our 2 candidates are John Kurtz, who's here tonight, and Peter Lane, who unfortunately is unable to attend due to a business conflict where he is on the East Coast. Probably not enjoying the weather too much. However, Peter has written a statement, and it's going to be read by his daughter, Josephine, who is accompanied by her mother, Ellen. So if John, Josephine, and Ellen could come up, please. Our sign maker had a little creativity with Peter's daughter. The format will be 3 minutes for opening statements, and then we do have 2 or possibly 3 questions, and John will be answering those questions, and you will have 2 minutes, and then there will be 2 minutes for a closing statement. So we will begin with Josephine. You have 3 minutes.
Hi, my name is Josephine Lane. I am in 2nd grade and my brother Elias is in kindergarten at Friar Harbor Elementary School. I'm here today as a representative for my father, Peter Lane, who is running for school board. He is sorry he cannot be here. He had a prior commitment on the East Coast. He is grateful for the invitation. My dad has worked in the arts his entire career. Music and art are very important to him. He graduated from Western Washington University with a degree in sculpture. After college, he began art handling, which is installation and transportation of fine art. After a few years, he became the operations manager of a fine art services company. He was also on the board of directors. He managed a staff of 40 people. He also had direct client contact with private art collectors and museums around the world. He managed human resource issues. As such, he has experience with profits and losses in corporate reporting. He now has a small business in art consulting and logistics. My dad feels that music and art are extremely important for children. Music and art provide emotional releases which other subjects don't always foster. Music and art provide a creative outlet, which all children require. Creative outlets promote creative thinking. Creative thinking provides skills for problem solving. Problem solvers are leaders. My dad wants to promote a community of leaders. When we lived in Seattle, my dad always hosted the block party. He believes in community. He volunteers at the San Juan Island Museum of Art, assisting with installations and serves on the exhibits committee. My dad would like to be involved in children's education in our community. He believes that he can be a leader in setting school policy and procedures and in budget management. which she feels are the main roles of school board. Thank you.
Thank you, Josephine. Thank you, Ellen. Juan?
That's a hard one to follow. Yes. That was very great. Way to go. Very good public speaking. My name is John Kurtz. I've lived on the island for about 19 years now. I moved up here after I married my wife, Cassie Marble Kurtz, who was born and raised here. My oldest son, Alec, is 19 and is a graduate from Friday Harbor High School. I have another 14-year-old son, AJ, who's a freshman in high school. So I've been parenting through the Friday Harbor Schools, the San Juan Island School District, for a few years now. I've had the privilege of volunteering for the 6th, 7th, and 8th grade overnight field trips that they do. I've been involved with fundraising through other charitable committees I belong to for the budget shortfalls we started having back in 2007, 2008. So I'm fairly aware of, what we're fighting for and what we need to do, and I'm really impressed with where we're at right now with having such a top-rated school with the financial difficulties we're always faced with. My latest ventures have been with the Carter Street, the San Juan Community Park at the end of Carter Street, which is a community park built with private funds on school property within the town limits that will be run by Island Rec. So as chairman of that committee, I've had a lot of dealings with the different councils, the board members of the school board, the town council, and a lot of mediation and stuff, and I believe that I can offer the school board a reasonable voice and someone who can compromise and bring clarity to problems that might need to be faced. So I'm excited about the opportunity to serve on the school board. Thank you.
We'll now move to two questions that were turned in from the audience, and I'll give Ellen and Josephine a moment to go ahead and exit stage left. Thank you again, Josephine. John, normally with League of Women Voter events, if both candidates cannot be here, we typically do not allow candidates to answer questions. However, because this is a local, nonpartisan position, we asked our league for permission so that all of you who are here would get an opportunity to hear at least a few questions from John. And they politely said, sure, go ahead. So there are two questions. John, the first question, what do you see as challenges and opportunities for the San Juan Island School District? A few specifics, if you could, and you have 2 minutes.
Well, I'd say some of the challenges we're facing right now and have been actually facing and been dealing with already are some of the care for the buildings. We've been re-roofing Turple Gym. There is problems with the locker rooms in there. There's also just funding for enough teachers. I mean, we don't have enough teachers in the elementary school, and I think it's our opportunity would be to go out as board members and seek the grants and apply for the grants and sell our district to the legislature that we can get this extra funding our way instead of just relying on our attendance and stuff. I think it's up to the board to go out there and actually foster the grant seeking, and that's what's exciting for me about being on the board.
Thank you. The second question, what directional changes, if only small tweaks, would you like to see take place as the school board's leadership? I'll read it again.
No, I understand. There's just a couple different ways of facing that one. I believe that the school board needs to take on more of a community feel again. I think that for a while there we had some people that came in with some agendas from bigger cities and so forth. I think it's time for us to kind of come back to our roots. I also think that perhaps the school board, don't take this wrong way, shouldn't be too approachable. I think that maybe parents should be going to the teachers first, and then from the teachers to the counselors, and from the counselors, if they don't get their answer there, to the principal, from there to the superintendent. And at that point, if there's no resolution, then of course maybe the school board has to get involved. But I believe the school board should be providing the funds and having the access for the people that are in the buildings to perform their curriculum. I don't think we should be as hands-on with that part of it. So that would be my tweak to the leadership now.
Okay, very good. And with that, that was the second and final question we had for you, John. And you have 2 minutes to close.
Okay. So yeah, the only other thing that comes up there is I'm excited about our new superintendent. I don't know if any of you have had the privilege to meet Anna. She is an excellent woman, and I think that the school board did a great job in picking her. I'm really excited about the future that she poses for the schools. And other than that, I'm just excited for the opportunity to kind of serve you people the best I can.
Great. Thank you very much, John. Races. This is the Public Hospital Commission, or specifically San Juan County Public Hospital District number 1. We have 3 different positions that we're being asked to vote on. The first is Hospital Commissioner 2, which is a 2-year unexpired term. And the candidates are Dr. Michelle Loftus and Barbara Sharp. The second position is Hospital Commissioner 3, which is a 6-year term, and the candidates are Monica Harrington and Jenny Ledford. And how's Jenny doing?
She's on her way. She was expecting at 7:25, I think, or so. We got on something.
Yeah, we're a little ahead of that. Jenny's not feeling well, so we may just tap dance just a little bit until she gets here. She's a bit under the weather, but her husband said she'll be here as soon as she can.
I'm not sitting in for her.
I'm not watching you. The third position that we have is Hospital Commissioner 5, which is a 6-year term as well. And the candidates are William Hancock and Bill Williams. So we have everyone here except Jenny Ledford, and I need to pause for oh, there's Jenny. Hi, Jenny. Bravo.
I'm sorry. Here you go, my kid.
Take a minute. I have to go to the back for just 1 minute.
Excuse me. I hope not.
Well, I think we have lots of hospital and EMS people in the audience here, so we're in good shape.
They called me earlier. Has this been tested recently? I know it's true. I'm going to find out something.
Okay. Unfortunately, because Grange's wonderful microphone here,
Just a minute.
Roger's going to fix it. I was going to say we're going to have to share one microphone, but hopefully that will not be the case.
Will you give it a shot?
I'll be happy to give it a shot. Does it work?
Do we need to
hear me?
turn it up?
Could it go up a little?
What was the trick to that, Roger?
Wasn't plugged in.
Yeah, it needed to be turned until it clicked. Then it went in.
That.
This.
Yeah, okay.
Okay. My job is done here.
Okay. Okay, really? Everybody can hear me? No. Okay. Can everybody hear me now? Great. All right, let me review a few things before we begin. The format for this evening is that each of the 6 candidates has 3 minutes to make an opening statement. Once the opening statements are complete, then we will go to written questions from the audience. It's very likely, given time, that we may not get beyond 6 questions. I would prefer not to have audience fatigue and have people leaving. So we'll try and give you the most relevant 6 questions that we've gotten. If we have time for more and everybody's got the endurance and the candidates have the endurance, we can go on. But that's my target for this evening. Once all the questions are completed, then we have 2 additional minutes for each one of the candidates to make a closing statement. The way I've seated everyone is Commissioner 2, Commissioner 3, Commissioner 5, and also alphabetically, Michelle Loftus, Barbara Sharp, et cetera, et cetera. And I'm going to diligently try to give everyone an opportunity to be first to answer their question. One last thing, if a question has been written specifically for a candidate, sorry, I'll go into my crouch. If a candidate has a specific question that's written to them, they will have 2 minutes to answer, and their opponent will have 2 minutes to answer, but the other candidates will not participate in that particular question, so that we can keep everybody on track. So, all clear? Great. Then we shall begin, and Dr. Michelle Loftus will be first with 3 minutes. Is it on, Michelle? Yeah.
Counselor. Well, I'm Dr. Michelle Loftus, and I'm really thrilled that we've had such a response to this position. I come here, and I'm really humbled because I see neighbors and friends. I see folks that we've sparred a little bit on the county council chambers. And you know what? What are we all? We're Islanders, we're neighbors, we're friends. When I'm Hospital District Commissioner, I'll bring not only administrative experience to the district, but also managerial, business, political, and medical knowledge. Our community needs leaders who work for the safety and security of our friends and neighbors here in San Juan County. Campaigns often incite fear and discourse to drive an emotional vote. I want to positively campaign for the security of excellent health care in our hospital district by promoting the many life-comforting services provided by Peace Health Hospital and our local EMS. Working with the Prevention Coalition and other community health services is also a piece of a hospital commissioner's job where I have experience. I have practiced as a veterinary doctor for 29 years. I have seen during that time both experience with corporate and private veterinary hospital administration. If you want compassion and efficiency, a veterinarian is a good source. Veterinarians run full-service hospitals with close, tight budgets. As a veterinary doctor, I've trained for public health work too. As a farmer and a business owner, I'm also trained to watch a budget, deliver services, and manage employees. Those are all important things for a hospital commissioner's job. As past vice president of the San Juan Economic Development Council, I appreciate the economic driver Peace Health Hospital has been for San Juan Island. My political experience has provided knowledge of where our health care meets government. As part of Leadership San Juan's Cohort 9, I received leadership training as well as an awareness of our county's diversities. I will work to encourage community stability by serving as a hospital commissioner. Our island way of life is important to me. I would appreciate your vote for position 2, November 3rd. Thank you.
Thank you, Michelle. So there's one thing that I did not mention, and that's sitting in the front row are 2 gentlemen, one with a timer and the other one with cards. Elle, would you just hold up the cards? So the candidates know that they have 3 minutes, so they have 2 minutes, then they have 1 minute, and then they have a big red stop sign. And so we're right on track with Michelle, so thank you very much. And now Barbara Sharp.
Thank you very much. I've been a full-time resident of San Juan Island for 13 years, and I've been a property owner since 1978. Like many of you, I came here for a visit, and I never wanted to leave. I'm running for commissioner to provide island residents with the best possible range of health care, delivered efficiently and in compliance with state law. The public hospital district is a creature of state law, and it's bound by it, and so also are the commissioners. By law, the public hospital district commissioners are charged with providing health care needs for everyone in the district. As a retired attorney, my pragmatic and and rational legal expertise and experience will be a great asset to the commission. I have skills of critical thinking, analysis of data, cost-benefit analysis, and through both my legal experience and my community experience, I have skills of teamwork, collaboration, and communication. I worked as a judicial clerk for an appellate court of appeals. I was a staff attorney for a workers' compensation insurance company. And here in Washington, I worked for the Attorney General's office in Bellingham, representing BSHS in cases of child abuse and neglect. Here in retirement, I've been active in several nonprofits that are devoted to community service. Sir Optimus International, Friday Harbor, Board of the Friends of the Library, and Board of the League of Women Voters, although I did recuse myself during the campaign from that duty. I want to continue my public service with being a commissioner on the Public Hospital District Board. There's been a lot of misperception that I favor litigation. This is absolutely untrue. I believe that collaboration and discussion are ways to settle differences. The most critical issues we have facing the board are the passage of an EMS levy in 2016 and maintaining a sustainable budget. We're fortunate to have Peace Island's expanded medical services, and I'd like to work with them to provide lower cost services for working people. I'm rational, I'm pragmatic, I will follow the law, and I will speak and act professionally, and I want your vote on November 3rd. Thank you very much.
Thank you, and now Monica Harrington.
Hey, my name is Monica Harrington, and my husband and I moved here in 2000, and we started building our home then. We have many wonderful friendships here. Many of you are here tonight. Thank you. I became involved in healthcare issues for reasons that are both personal and professional. When I was 5 years old, my father was diagnosed with metastasized melanoma. There were 8 children at home under the age of 18. He couldn't work for 2 years as a consequence of that illness, so I know how disruptive it can be. From a professional perspective, I'm a former technology executive turned patient rights advocate. I'm also a former National Park Service ranger. I worked at Crater Lake, where part of my job involved dispatching and coordinating emergency services. Later, I was recruited by Microsoft, where I worked for 11 years in senior marketing and business development roles. And after Microsoft, I helped start 2 very successful companies. It was after selling our interest in one of those companies that we moved to the island. And then 5 years later, I got an opportunity I couldn't refuse to work with Bill and Melinda at the Gates Foundation, so I returned to Seattle to work for a while. After leaving Gates, I started doing some pro bono work in healthcare, focused on patient rights and access. And this weekend, I'll actually be speaking at a healthcare conference sponsored by the University of Washington Law School and the Department of Obstetrics and Gynecology. Here on San Juan Island, the 50-year contract between the Public Hospital District and Peace Health requires us to turn over 97% of all available funding to a religious ministry that then has the right to decide what services we can pay for. The Public Hospital District has no effective oversight authority and no room to fund services that Peace Health chooses not to provide. Since Peace Health opened, we've gained some things and we've lost some things. There are expanded services, valuable services in some areas, including cancer care and higher-end diagnostics. But we've lost some important things too. Services that used to cost a couple $100 for things like earaches and stitches now cost much, much more. And instead of openness and transparency about what services are provided, especially around reproductive health services and end-of-life services, we're in this strange world of don't ask, don't tell, and sometimes don't refer. Things can be different. In my view, Peace Health can and should be an important provider in the community, but it needs to be open and transparent about what it doesn't provide, And for the services it chooses not to provide, we should be able to use public dollars to support those services elsewhere. We also need a trustable, sustainable EMS budget that our community can support. Above all, I believe we need to ensure that we're providing healthcare services in a way that matches our values and our pocketbook. And that's why I'm running for this position.
No, Jen.
Can you hear me at the back of the room?
No.
Can you hear me, Sharon?
No.
Don't
go
by me. Okay. You better use by me. Well, obviously you can hear me. Okay. I'll use the bad mic. I'm Jenny Ledford, and I'm running for position 3. I thought maybe I would start this evening by asking a question that was asked at the last forum I thought was very helpful. How many people in this room came here tonight with no decision made about who they're going to vote for? Would you raise your hand? Those 8 people need to pay attention to all 6 of us. I moved here in 2002 with my husband. I am not feeling really great this evening. I ate something that didn't agree with me wholeheartedly, but I'm going to do a great job tonight irregardless. So we moved here in 2002, and at that time, Richard decided I needed to unpack my suitcase for the final time. I'd been a consultant for almost 30 years. My background is, I left high school at the age of 16. Okay. And I've made my way in life to be a successful person, regardless of my opportunities that were out there for education that I chose not to participate in. I was the youngest person in the state of Georgia to get a real estate license, and I had a very difficult time getting started. The first month I sold 11 houses. And I did that because I had a daughter at home who was seriously ill, and I didn't have money for rent next month. I worked that career. I was in that career for almost 9 years. I sold for 6 and taught for 3, almost 4 years. I became a GRI instructor, Graduate Realtor Institute instructor on the national level. I left that career to go into the consulting business that I ran for 27 years. And I would go in and do assessments on underperforming companies and government agencies. I was tasked to find out why they were not meeting the mandates of their charter if they were a government agency, or why they were not reaching the expectations of their stockholders. My background, I've done over 300 projects, ranging anywhere from the Food and Drug Administration, who were clients of mine for 19 years, to the Health Protection Branch of Canada, to huge hospital chains like Centera Healthcare Systems, to huge insurance companies like Anthem Blue Cross and Blue Shield. The Center for Radiological Health and Devices, which oversees everything put into your body from a new knee to an eye cornea transplant to whatever our clients have clients. So I've worked with people with all kinds of backgrounds. And I always like to add, since my husband is a coach, but he didn't coach basketball, is I worked with Bobby Cremins with Georgia Tech, and they took him to the Final Four. So what I know how to do is I teach critical thinking skills. I teach strategic planning. I teach and help people understand conflict resolution. I am a problem solver and a problem solution finder, and I am a creative and innovative thinker for people to be able to think outside the box. And I hope you will consider voting for me on November 3rd.
Thank you. And now William Hancock.
Good evening. I'm Dr. William Hancock, and I want to be one of your next hospital commissioners. I'm both a medical doctor and an experienced medical manager. I was a founding owner, the chief surgeon and manager of Northwest Eye Surgeons of Seattle. When I retired in 2008, we were employing 13 doctors and 200 staff in our 5 surgical centers. That 30 years of on-the-job training has made me ready for this job. I know how to work others, even those that don't agree with me. Public hospital commissioners do not normally get involved in direct patient care, hands-on patient care. But they frequently have to talk to people that are on that frontline job. Now, I've been in both places, and I speak both languages. Before you mark your ballot, I'd like you to think carefully about a question that has become central to this election. Can you trust this candidate to focus on your health care, free of influence from any partisan group? My answer to that question is absolutely yes. I run an independent campaign, and I've not obligated myself by any association with another group. And I also don't make promises that I can't keep. Now, there's lots of good news on our island healthcare scene. Lots of exciting things. Our new hospital and its services have reduced the number of off-island visits by 9,000. And last year, emergency medical evacuations are down by 45%. That's 312 that didn't have to go off last year, and that is a saving of almost $6,000. Ha! Boy, did I blow that one. How about $6 million? Because each one of those off-island visits by helicopter costs $19,000. So, new projects on the island. There's the Veterans Choice Initiative. Vets are now going to be able to have their services done here at our hospital. There's also the new EMS paramedical and paramedicine program. It's new, but what it's going to do is focus on the healthcare needs of our seniors and us to keep us safer in our houses. What does that mean? Less visits to the ER. That means saving money, and saving money is definitely a job of your hospital commissioners. So,
Bill.
Thank you for your attention.
And now Bill Williams.
Good evening. Thank you all for being here. My wife and I have been island residents for 15 years. We own a small manufacturing business that employs 2 of the best employees a company could ever have. We have great neighbors, a community of wonderful friends, and we truly love living on the island. Prior to moving here, I spent 30 years managing military, civilian, and Kaiser Foundation hospitals, ranging from a 60-bed MASH unit to a 440-bed acute care hospital. I also managed a variety of clinics and physician groups, ranging from small troop medical clinics to a large 70-doctor multi-specialty clinic. Before the opening of the new hospital, I was involved in discussions regarding what to do about the unsustainability of the Inter-Island Medical Clinic. The critical access hospital looked like a viable solution. We now have a modern facility staffed with caring individuals, a full-time emergency department, and a range of healthcare services that reduces the need to travel off-island for healthcare. However, we have some new problems. Shortly after the opening of the new hospital, islanders began contacting me about their medical experiences and their sticker shock over higher prices. One early situation involved a young man that went to the clinic with an earache, and because no urgent care was available at that time, he was later billed $800 for that visit. I was later contacted by more than 40 people who told me similar stories. I became more involved and began talking with PIMC administration. In a few cases, I was able to convince Peace Health to reduce or eliminate bills that they had sent to patients. I began attending the public hospital district meetings and board of health meetings. I talked with doctors and other community health care providers. I looked into issues regarding EMS levy failures, laws governing the public hospital district, and laws protecting the availability of specific health care services. If elected, I intend to work for island health care that is affordable for working islanders, that treats patients fairly and equitably in the provision of primary care, urgent care, and emergency care. that provides patients with information on their complete range of healthcare options so they can make informed decisions about their care. My priorities will be to build a sustainable, well-managed EMS and include the passage of a sound budget for 2016 to assure the district complies with all laws, to include Washington's Reproductive Privacy Act, and that our citizens have direct access to providers with death with dignity, to improve the oversight and control of our tax money, to improve relationships and contracts with patient air transport providers, and to improve relationships between the community and the public hospital district. Our task is to build on what is already in place. I'll apply my time, energy, and experience to work for an enduring healthcare system that meets the needs of San Juan Islanders, and I'm asking for your support. Thank you.
Thank you all for staying basically within your time limits. Thank you. Bill, sorry. All right, we'll move to questions. I have 5 here, although one of them appears to be about 4 questions all rolled into one. So I'll try and bring that together while I'm asking the first couple. The first question, and we'll start with Phil Hancock, and then Bill Williams, and then Monica Harrington, Jenny Ledford, and Michelle, and finally Barbara. And the question is, setting aside the passage of the EMS levy, which I believe everyone agrees is a necessity that has to happen, what do you hope to accomplish if elected as a hospital district commissioner? And please be specific.
So I'm not to talk about the EMS levy, correct?
On this particular question, no.
Very good. It's important to work with each other. I said in the last forum that I wanted all of our population to feel comfortable with our hospital. I want them to know that they're there for their good interest. And I think that part of that is knowing what they're doing. I am especially excited about some of the opportunities that we have with the things I mentioned. The EMS paralegal program, paramedical, and the Veterans Hospital privileges that are going to be done here. That's going to be a big thing for the vets, and it's going to help the volume of our hospital. Increased volume, less cost.
Thank you. Bill?
Well, I think I alluded to a number of them in my opening statement. I certainly think it's important for the district to improve the community relations. There's a number of ways that I think we can approach that. A lot of it got started with the fact that the hospital district meetings now are video recorded, and I hope that gets out. People can see that and become more involved in what happens actually at the district. The oversight and control of our tax money is a major operation that the district is responsible for. I want to get involved in actually how all of that is actually calculated. I'm having some meetings where I'm starting to get more of that kind of information, and I think that's something that I want to be able to talk to the public about. Where does our tax money really go, and what's it going for? Another thing is the contracts with the patient transport providers, the air transport providers. I've had some conversations there. I want to look at those. I want to work on improving those and having good relationships both with our helicopter and our fixed wing transporters. The Washington Reproductive Privacy Act and the Death with Dignity Act are both passed overwhelmingly by the voters of this island, and I want to be sure that we have good direct access for both of those kinds of services. And I think that would probably be most of them. Thank you.
Thank you. Monica?
Sure. When I think about that
biggest issue that I'd really like to address, aside from EMS, it has to do with ongoing local oversight and control of our public tax dollars. One of the responsibilities that a public hospital district commissioner has is to actually oversee service quality and operating performance. And this comes directly from the RCW that basically controls how public hospital districts are set up and the powers and duties of a public hospital district commissioner. So that's critical, and one of the areas I'd really like to look at is how we can make care more affordable to working islanders, especially for those urgent care visits. I've just talked to way too many people who've gone through the doors of the building and have been hit with a very high bill. And one of the things that I'm most scared about on behalf of the residents of this island is that when that happens and you get a high bill, you don't go back and you might not get the care that you need. So that's critical. And I also think there are some services that Peace Health is simply not going to provide, will never provide, but it doesn't mean that our public hospital district as a public entity shouldn't support. And so there needs to be, in my view, a way to fund those services, to fund services that Peace Health chooses not to support. And I think all of this is eminently solvable, and we can all come to the table and make this happen, and it's in the best interests of islanders.
Thank you.
Be specific. Okay. Would you read me the question again?
Certainly. Setting aside the passage of the EMS levy, which everyone, I believe, wants and needs and believes is important, what do you hope to accomplish if elected as a hospital district commissioner? What do you hope to accomplish if elected as a hospital district commissioner? Please be specific.
Sure. The contract with this beautiful hospital that was built with $20 million put up front and $10 million raised by our very generous community is totally paid for. The tax dollars that are collected, the wisdom of the contract as it was designed, goes all to charity care, either to help pay for bad debt and emergency physician services. 96 and a small percentage above that goes for those services. The other 3.5 approximate percentage goes to pay for the actual running of the public hospital district itself. There's one full-time employee, she's a superintendent, and so she has full-time salary and benefits. The other goes to pay the stipend of the 6 commissioners. They get a whopping $114 a meeting before taxes. And if you have an executive session, you get another $114. There are also, it covers ancillary costs, like this year we had a CPA consultant who came in to help simplify the reporting process. So people, like the average voter, will be able to look at the information and be able to determine where the money is going. And it also helps us track trends so that we can be forward thinking. Okay. Some of the things that we need to do in the EMS, specifically, there's got to be a new chief hired. There needs to be more support for some of our senior services. I have, at the end of the night, when I do my closing statements, I'm going to give you what I consider my vision for our health care. So specifically, we just need to manage, make sure we constantly look at the budget as it comes to us, look at how the tax dollars are spent. But as far as providing other additional services, those can be created through a public hospital district, but we always have to go back to the voters for funding or find creative ways.
I think we've had some very good answers here. There's not a slouch behind this table at all. We're very fortunate to be represented up here by some fine citizens of our community. So how is my approach different? It's very similar. However, I look at the job of the hospital district commissioners as fiduciary, primarily fiduciary. So what we do is we'll be looking at the EMS levy and the hospital levy and just watching those budgets and seeing how we can prepare for things that come our way. EMS, okay, I'm not talking about the levy being passed, but it has some exciting outreach programs that we will all benefit from. Not only are we getting CPR classes increased, the paramedical program that Bill referred to is coming our way. Maybe our community can look at holistic and naturopath services. Those things are things that we're all interested in, and I would promote that in our community. As far as the hospital goes, we are not the hospital board, so we can collaborate with the hospital board as to the services that they are increasing every day. We're a little concerned in this community about prices of health care, but that's not our job to set that. I will have the honor to say that our hospital is working on different ways to put those services out into the community. The word escapes me right now as to what it's called, but you have different ways of providing your physician services to your community in various ways, and that's going to help us a lot, and I'll be able to work with the hospital board on that. Thank you.
Okay, first thing, I would really want to work proactively with Peace Island, and this can be done within the confines of section 1.13 of the contract, which says that Peace Island agrees that such clinical services shall be at a minimum primary care, emergency care, so forth and so on, provided that the district and Peace Health may mutually amend these specifications. Now, I think that means take a proactive approach with Peace Island to aggressively look at what services will benefit the community. And second, I think the public hospital district has to increase its outreach to the community so they know what we're doing. Yes, our video, it's wonderful that our meetings are videotaped, and that people really can't go to the meetings. A lot of people work, they're home with their kids, doing homework and so forth. So I'd like to see something like maybe a feature on the website that would allow people to leave questions and answers. And also, with the current subsidy situation, if there's some way we could work out to help working people that have insurance but have very high deductibles and therefore have to be out of pocket for a lot of costs. All their basic costs, their basic preventative care comes out of the pocket. They're left behind in the subsidy. The subsidy takes care of emergency service, physician services, bad debt, and indigent people, and most mysteriously, Medicare. Our subsidy subsidizes Medicare, even though as a critical access hospital, they're entitled to 101%.
Thank you, Barbara.
Thank you.
The next question is, thank you. Yeah, just turn it off. We have two mics up there. One of them is the good mic, and you can turn it on and off, and the other is the bad mic. You cannot turn that off because it screeches. So this side of the table got the bad mic. All right, the next question, and this is for all the candidates. As Public Hospital District Commissioner, what are your thoughts for working with the community to ensure that health care is affordable and accessible to all island residents? And we'll begin with Monica Harrington, please.
Sure, this is the big issue that really motivates me. It's making sure that the health care on our community, the publicly subsidized health care on our community, is available and reaches the people who need it most. In all of these meetings that we've had, I look out over the audience, and older Americans, or older residents, are very well represented here. But there's also a lot of people who don't come to these meetings. There's a lot of people who don't go to the public hospital district meetings. They are the waitresses, the people who are working in town, the people who are taking care of so many things that we all care about. I deeply, deeply care that our public tax dollars are going to help support the members of our community. There's a lot that we can do in terms of outreach to understand the needs of the community. And the reason I think it's so critical that the public hospital district have ongoing oversight and control of those public tax dollars and is able to make adjustments is that there are services that would be beneficial to the members of this community that often, where their voice often isn't heard. I really want to make sure that we are working towards solutions that work for people who are underrepresented in so much of the dialogue that we have going on.
Working to make health care more affordable is not really something that comes under the public hospital district mandate, Commissioner. Healthcare policies and insurance policies and Medicare actuarial people are the ones that set the cost for healthcare. When you're talking and speaking about people being subsidized that have Medicare, and you're maybe thinking that we subsidize Medicare, what that subsidy goes for are people who are underinsured. I personally have a Medicare supplement program, but not everybody does. And we know Medicare pays a portion if you buy the supplement, but that's supposed to fill in the gap. We all know that that even has a deductible on that. But there are a lot of people who just have plain Medicare, and so they are underinsured, and so the things that's not covered, that's part of what the subsidy goes for. So there are a lot of islanders that have Medicare, but they are underinsured. Okay? So we can't really affect the cost of the health care. That is set by other people. What we can do is look at what we can do to expand services on the island, because the more services that are offered, the more revenue that comes in, and the lower the price goes. That's always the way things work out. So now that we have, they're already beginning to expand some, surgical services and things like that. There's certain things we can and cannot do as hospital commissioners. One of the things that I have an idea of is how to exactly meet the needs of the people that Monica is talking about, because we all know that there's a huge, large number of people who sort of fall between the indigent and the people who are fully insured and can afford it. Okay? And I have an idea, it's a template that's already working in a lot of places where we can, as a generous community, make that available without tax dollars.
Thank you, Jenny. Challenging when you're not feeling well.
I'm sorry?
Challenging when you're not feeling well.
Thank you for recognizing that.
I'm going to read the question one more time, and then we'll move to Bill and Bill. As Public Hospital District Commissioner, what are your thoughts for working with the community to ensure that health care is both affordable and accessible to all island residents?
Affordable and accessible. Those are important words. That's something that I dealt with for 30 years in my business, balancing economic reality with needs. That was my job. How do we control expenses without decreasing quality of care? It's a big job. And it's also touched on what I see as one of the real challenges for all of us. It isn't going to get easier. You use the word subsidy. Before, the subsidy was to keep primary care doctors here. Now, is to take care of those that are less fortunate. So how am I going to provide affordable, better utilization of the services we have, a higher volume, as Jenny has pointed out, fixed infrastructure, if you have more volume, the cost divided become less. We are limited in what we can do, but I will certainly look at supporting those activities that may increase the volume for all of our services here. And also, I want to hear the problems that people have, and then we can take care of them. Thank you.
Thank you, Bill.
The role of the hospital district under the RCW 70.44, after a lot of words, basically comes down to providing hospital services and other healthcare services for the residents of the district. And I think that is the role. It goes beyond passing out the subsidy monies and things like that. It actually says, let's look at what the community needs, and then let's try to find ways to meet those needs. I had said in a previous forum that I thought my test for healthcare is whether it's available, accessible, affordable, and high quality. Those are measurements that I look at to say what kind of healthcare are we providing and how are we doing. Something that's happening right now is the increases in your premiums and the increases in deductibles. I've talked with several insurance people recently, and they know these things are coming. So the problems that we have with affordability is actually going to increase. So one of the things that I look for is efficient utilization of the services. I've said that I think the services need to be provided at the lowest cost, medically appropriate setting that we can find to provide them. And for me, that's been, let's push for urgent care, reducing the emergency part. That'll help. But we're going to have to get creative and look for other solutions as well. The collaboration between the hospital district commissioners and the hospital board, I think, is something that I really want to work on, because we're going to need to work together to work on helping to keep the prices as low as we can.
Thank you. Michelle?
I like this question because I've been doing it for 29 years. As a veterinarian, we have to watch our bottom line. Traditionally, we do now have insurances, but traditionally we have not. So I have to consider my patient needs. I have to consider what's best for that patient, offer it to the owner. They can or can't afford it. We have to be creative. We have to figure out another way to get that service for the patient. Why do I mention this? Because I speak the language. I know what our hospital is against. I know what services and standard of care is required of doctors and hospitals and EMS services these days. I know that I'm not going to be enforcing a conversation with a cut that's going to cost us quality of care. Healthcare is expensive. We have to find ways that we here can be healthy and happy and true islanders to each other. And you know, we're all out here on this island for that very reason. It's a great quality of life we have out here. We look around the audience here, and we have lots of seniors here because you're mobile, you're active, you're out there hiking, you're having good nutrition. You're going to be having these paramedical services to help us. Hospice care here on our island is a great service. The nice thing is we can all be assured we can grow old together here, and I'd like to be a part of helping to do that.
Thank you. Now, as I said, I follow the law, and I agree with Bill that the primary legal job of the public hospital district commissioners is to provide for the health care needs of our district residents. Now, as I said before, working people with insurance but high deductibles are left behind. And I think one way, and I think Bill also touched on this, is some kind of structured urgent care, because you have the construction worker that comes in and he hit his finger with a nail gun or something like that. he goes to the emergency room, it's a high price. If he can't get into the clinic, what is he going to do? So if there's some kind of structured urgent care, that would be a help. Also, I think in the subsidy that goes to physician services, that can be possibly channeled into lower cost preventative care. Now, they give out free shots to children, which they should because our immunization rate is abysmal. But how about the adults? How about the adults? They should get lower cost preventative care because everyone benefits. Our community benefits from preventative care and the patients benefit. And I also would like to point out that the Medicare subsidy isn't just for people with Medicare only. I talked to the administrators of Peace Island with that specific question because I thought, why else would you subsidize Medicare, particularly someone with gold-plated supplemental Medigap policies? And he said, they're all in there together. And that's not correct, and especially because of the critical access double or triple reimbursement rate.
Thank you, Bob. The next question's a bit of a mouthful, so I'll read it once and then I'll read it again. Will you comment on your views regarding the ACLU and possible litigation? And if a lawsuit is brought against the public hospital district, are there any conditions that exist that would cause you to resign from the hospital board? Yeah, I'll be happy to. Will you comment on your views regarding the ACLU and possible litigation? So that's kind of part A of this question. Part B is if a lawsuit is brought against the public hospital district, are there any conditions that exist that would cause you to feel you needed to resign from the hospital board? Everybody want to take a minute? Pardon? Do I need to provide any additional clarification, or is everybody okey-doke?
What's the ACLU lawsuit?
I can't comment on that because it isn't written on this question, so I'll just leave it alone and we'll move on. Someone in this audience feels this is an important question, and here it is. So, pardon? I'd like you to go first, Jenny, if you don't mind. I'm following my attempt to give everyone an opportunity to be first. You're welcome.
I'm glad my time's up now. For those of you who don't know, the ACLU has written a letter to our public hospital commissioner board saying that they feel like that the public hospital board is in violation of the Women's Reproductive Health Care Act against the law and also against our state constitution. So that's what that letter is about. That letter was responded to by a really fine group of attorneys who make health care litigation their specialty, and the response is very cogent and very well put, and I hope you read that in the journal. I'm not going to read it to you, but those responses are there. I'm not a lawyer, so those are the kind of things that you have to leave to those people. I will tell you that the lawsuit, and this is my opinion, from the research I've done, is part of a broader, larger issue that is being promoted by some people on Island are supporting it, and you need to understand. The ACLU was alerted to what they consider to be violations of the law or constitutional law. There was a letter written to the Attorney General and to Governor Inslee, and intent was made to change and go after our certificate of need. If you want to know what a certificate of need is in legal language, it's our business license. Hospitals and healthcare facilities have to have and fulfill a certificate of need. That litigation cost a lot of money. I said close to $1 million. And it was supported and signed by people that are running for the hospital commission. And it was unanimously tossed out by the state Supreme Court as non-valid. So now they're going after the...
Take 30 seconds more, please, and then finish your thoughts.
Okay. So now the ACLU is going after Skagit Hospital, San Juan Hospital, and a couple of others with the very same information, okay? Because the Attorney General, who responded to the initial lawsuit against the Certificate of Need, chose not to opine on part of the law as it is written in the Women's Reproductive Health Care Act about if you provide prenatal care and maternity benefits, you must provide substantially equivalent services or information.
Thank you.
And so that has not been opined on, and that's what these lawsuits are about.
Okay, thank you. Barbara? There you go.
Okay, I read the ACLU letter also as the response from Attorney Bradley Berg from Foster Pepper, and basically the letter had alleged that Peace Island did provide some maternity care, some level of prenatal care. And the analysis of the attorney was that the hospital board, who was ultimately responsible for the contract, there was nothing in the contract that provided for maternity care, which is true. The word maternity care does not appear in the contract. And as far as providing maternity care in Peace Island, to my knowledge, the best is the services that are provided by Fidalgo Medical Associates. They have 2 OBGYNs that lease space, but they are not Peace Island doctors. And that's not to say whether they should or shouldn't, but that's the situation. I don't see anything, they haven't had a response from the ACLU to Mr. Berg's, but there was testimony at the last Public Hospital District Board meeting, and about different people from the hospital stating what was and wasn't done. And I believe they're right. I'm not saying I agree with that there should be. There probably should be some maternity care provided other than the twice a month from Fidalgo Medical Associates. But the way it stands now, I believe the attorney was correct. And there isn't anything that would cause me to resign.
Thank you. Jenny, I missed a piece, and that was there anything that would cause you to resign?
No.
Thank you. Let's see. William Hancock.
No, I won't resign either. I'll be back.
Thank you for clarifying that.
I hope you listened to what Jenny said. She said that in part, we have collectively brought some of the suit upon us. Microphone, okay. I also listened to Barbara at the first forum in the primary, and she was asked this question, and she said, no, we are not in violation of the law. I'm sure that maybe you're not aware of it. Part of the precipitation of the suit is the claim that we are using tax dollars that are being influenced by the Catholic Church to not provide legal services. When I looked into this, the people that set the hospital up, and I was on that committee, were very, very smart. We needed to take... Oh, I'm sorry, that's not a cool thing to say. Excuse me. They foresaw the possible challenge based on the Catholic Association. And that's why they essentially put the subsidy in a lockbox, a la Al Gore. They said this goes to charity care, and it's isolated there by contract. So there is no religious influence on the provision of those dollars, and those are our tax dollars. And for that reason, and I have the Foster Pepper letter right here, they said, rightly so, the suit is going after the wrong group. The Hospital District Board does not provide medical care. So, it's going to continue. Be ready for it, and be aware of what's going on. Follow it in the paper.
Thank you.
So, back in the early 90s, the voters of Washington State enacted the Reproductive Privacy Act. And the Reproductive Privacy Act essentially said that reproductive health care decisions are private and that the government shouldn't interfere in a person's right to make whatever decision was right for them, and that resources needed to be allocated fairly. So that's the law, and the ACLU has looked at what's happening around the state, and the law is not being followed. And there are places around the state, and I'm going to point to Jefferson County, which serves the Port Townsend area. The Jefferson County Public Hospital District got a letter from the ACLU, and what they did was they said, we actually want to provide appropriate services to the residents of the district.
Thank you.
Much better, much better. So over in the Port Townsend area, what the Public Hospital District Commissioners did was they set up an expert task force, and they had physicians on it and members of the community and people who were balancing that, how do we provide appropriate services for people, for pregnant women, and follow the law. And they went off and they did a little bit of research. This all happened earlier this year. They got a letter early this year. And they came back with a set of recommendations that had the input of the chair of the OBGYN department at the University of Washington. And they unanimously adopted these recommendations. And so that public hospital district is providing the services that the community needs, and it will operate in compliance with the law. And I actually think that what Jefferson County did, where they were presented with a problem and worked very pragmatically towards a solution, is exactly the sort of approach that we should take here on San Juan Island. This shouldn't be litigated. It should be something that we do because it's the right thing to do for people. We want to follow the law, and we want to provide the services that are needed in this community.
Monica, the last part of the question was there something that would cause you to resign your position?
I can't imagine a circumstance that would cause me to resign my position. I'm committed to working on these issues.
Thank you. And Michelle?
Well, there's a lot of confusion about this issue, but I'm going to try to keep my points really simple. The ACLU has had several suits across the country on this matter, and they've been thrown out. They have had the wisdom of the courts to figure out that the reason for these laws was not to come and bankrupt our districts nor our hospital systems. If it comes our way, it's going to be very expensive. I think you as a voter need to make a stand on November 3rd for the candidates that do not support fighting this fight in court. We need to find a solution that will keep our tax money in our district and not in court. So please vote for me November 3rd. I've had a lot of medical experience so that I know the definitions that they're looking at in this system. I know why they're trying to pick through these little words, and our district has been scared of saying certain words. Do we provide maternal maternity care or not, do we do it by contract or not, that makes me crazy. Just say what you mean and mean what you say to keep us all out of court.
Thank you. I'm sorry, Monica, I have to ask, Michelle, I need to ask you the same question. Anything that would cause you to resign your position?
Absolutely not.
Thank you.
All right, I'm going to start with that end of it. No, it wouldn't cause me to resign. There's a couple of, well, there's several things that are there that need to be sort of brought together on this. Number one is we do have the Reproductive Privacy Act, and it spells out what that's all about. We have the ACLU, who has attorneys. They read the Reproductive Privacy Act, and they know what's happening in various communities. They're looking to see that the Reproductive Privacy Act is actually followed throughout the state. They challenge areas where they think that there may be a problem. And the people they challenge have a chance to respond. That will go back and forth. And the ideal thing that would happen would be is there would be some sort of a conversation as to why the ACLU thinks we're not in compliance and why we say we are in compliance because we don't provide the maternity services. I think that the best way to deal with these kind of things is to clarify each other's positions, if there's a need to negotiate, and if we fail at all of that, then we would end up in court. I don't think that running away from an issue or saying that this is not an issue, we're not going to even talk about it, is a good way to keep from ending up in court. I think dealing with anybody that challenges us as to why they challenge us, what is your reasoning that you're challenging us, what do you think we might do that would cause you not to think we're in violation, these are all good things that we could do. Ending up in court is a failure. It's a failure in our ability to actually work through problems. We don't want to be in court, and I don't know anybody that wants to bring us in court. And I think saying that you might vote for one candidate that will keep us out of court and other candidates that will pull us into court is really a red herring. There's nobody up here that wants us to be in court.
The next question is, I don't know, it's about 8 parts. So I'm going to try and put it together in a way that everybody can respond to it, and then I'm going to explain how I'd like to have the question answered by the various candidates. So the question starts out quite simply, a question for Barbara, Bill, and Monica, which under our rules of how we're going to do this means everybody's going to answer this question. So we're all in it together now. Campaign signs have been posted listing you together, which appears as though you are running as a block of candidates. Does this indicate that you agree on the majority of major issues and intend to work on them as a block if elected? That's part A. If we have time, what are the major issues on which you agree? What are the major issues on which you agree? And if so, what are they? I would hope that we could answer the front end of this question because to take more than 2 minutes or so per candidate, we're going to be here till, I don't know, 11. So let me read what I think the writer would like to know. Campaign signs have been posted listing you together, which appears as though you're running as a block of candidates. Does this indicate that you agree on the majority of major issues and intend to work on them as a block if elected? And I'd like to have Barbara, Bill, and Monica respond first, since this question is directed at the 3 of you. And then I'd like to have Michelle, and then Bill, and then Jenny respond once the first three have responded. Everybody okay with that?
Could you read it one more time?
Oh, sure. I'm here for you. It's a question for Barbara, Bill, and Monica, and it goes, campaign signs have been posted listing you together, which appears as though you're running as a block of candidates. Does this indicate that you agree on the majority of major issues and intend to work on them as a block if elected? One more time? It's okay, I'm here for you. Okay, all right. How about if we just have 2.5 minutes for each person so we can actually get this developed a little bit? And it's, the sequence, one more time, is Barbara, then Bill, then Monica, then Michelle, then Bill, then Jen.
I have been running my own campaign and continue to do so. I have my own campaign signs out, just my name. Not very many, but some out there. I was also approached by a group of citizens here on the island, and they are, very open about who they are and have published their names. And frankly, in this era of black campaign funds and Citizens United, I think that's very refreshing. At any rate, this group asked me to join in with Bill and Monica because we do indeed have some common points, but we all bring something different to the party. We all have different strengths. We have somewhat different points that we want to make, and I think the group decided that they liked what we were saying, and because we have those few commonalities and points, particularly with respect to more affordable care. And I'm comfortable with the situation, but again, I'm also running my own campaign.
Thank you. Next would be Bill.
I would say that I would have to agree with Barbara, and so maybe that's why we're on the same sides. There are a number of issues that we've talked over, and we found common ground on them, and the same with Monica. We each bring different backgrounds to the discussion. Mine is a broad healthcare background. Monica's is a background that's related to activism, related to maternity services and healthcare. This is an important issue. Barbara's legal background is very helpful when we're wading through various kinds of regulations and legal documents. And I think as what we discovered is we thought that we would bring a good mix to the board if we got elected. We each have different backgrounds, different strengths, and we work well together. Have I answered the entire question? Is there anything that I'm missing there?
Do you intend to work on them as a block if elected?
No, I don't see us working on things as a block. I think, in fact, one of the things I would like to see is a little dissension at the hospital district meetings. I think the idea that we constantly find ourselves in lockstep going along with whatever is going on shouldn't happen. And I think we should have some differences so that we have different points of view being brought into the discussions. And we've had these kinds of discussions among the three of us. And I would expect that the other two district commissioners and us would find the discussion all over the board.
Thank you.
I'm just going to use that one, Bill.
Has that other one scared you?
It has scared me.
It's now become the bad microphone?
Yeah, this is the bad one. So I didn't know Bill Williams until we started hanging out at public hospital district meetings. And he was really passionate about affordable care, and that's one of my passions too. And so we had coffee and got to know each other, and now we've known each other, I would say, years. And when we were thinking about running, I think one of the things that Bill and I said is, my God, what the board really needs is an attorney, a really smart, pragmatic attorney, the sort of person who just works through issues and just wants to get things done. And so I know on my part, I was thrilled when Barbara expressed interest in running. And I really think that what this is all about is respect for what each of us can bring to these issues that we're so passionate about. I'm passionate about making sure that the rights that we all voted for under the Reproductive Privacy Act and the Death with Dignity Act are protected. That's really important. I care about this issue about trying to get people from avoiding the emergency room when it's an urgent care situation. My background is in business. That's a business model problem. That can be solved, but you have to have the will to solve it. And so these are the types of issues I'd really like to tackle. And I've worked with lots of different people through the years. I'm very collaborative, and I'm looking forward to working with whoever gets elected. But from a personal perspective, I just have to tell you, I think my husband shares this view, that there's probably nobody better qualified for this board than Bill Williams.
Just to clarify the last part of this question, do you intend to work on these issues as a block if elected?
No, I mean, I look at it as we're going to work with, there are going to be 5 commissioners on that board. Whoever those 5 commissioners are, we're going to work together. It's going to take all 5 of us to get an EMS levy passed and a trustable, sustainable EMS levy passed. There are going to be some issues we're going to disagree, and we'll see what happens.
Thank you. And now, Michelle, comments from you. Do you want to try that again, just to see if it actually does work?
Is it working? She's got, it's the good one. It works better.
Then everyone promise me, don't turn it on. Please. Thank you.
Okay. Well, nobody asked me to be part of the Bill, Barbara, and Monica group. So, it kind of makes me wonder how far they did their research, because nobody talked to me about my ideas, my fine experience for this board. So I think there are some other political actions at work in our county, and I think we've talked about those at the other forums. But would I join that group? If I had to work with them on the hospital district board, I would be very cooperative. However, I think I'm really worried about Monica's position and transparency on this board. Her name has shown up in the objection to our critical, what's the right term, Jenny, certificate of critical.
I think to address that after.
Yeah.
I'm
sorry, Michelle.
Michelle,
hold on one second. If you're going to direct a statement directly at one of the other people, they will have the right to respond to that.
I would like for that to happen.
Fine.
Yeah. So when our hospital went to apply for its business license, essentially, it was objected to by Monica Harrington. You will also find her name associated with the ACLU suit. So I would love to hear her explanation on this point. So no, you won't see my name on a sign with hers. And therefore not with Bill or Barbara either. Now my opponent, Barbara, very nice lady. She's an attorney. I respect that. She waters the tree for the seroptimus at the Historic Museum, so I gotta appreciate that too. And I would like to work beside a person like her. But I just don't see that happening if we're both running for the same position, obviously. So thank you very much.
Thank you. Before you respond, I want everyone to be careful in their comments that they keep everything in civil discourse. I'm not saying that anything has happened, but it's right up against the line, and I'd prefer that we just simply don't go there. So, Monica, you're more than welcome to respond. I think you have about a minute, and you can pick whichever piece you'd like.
Sure. So first off, I never objected to the certificate of need process here on San Juan Island. That's completely false. What I did say is the governor actually recommended some rules by which hospitals would have to be more transparent about how those deals went through. And I wrote a very strong letter basically saying that I think transparency in these transactions is absolutely critical. And so that is part of the public record, and that's what my comments were about. And I hope that addresses the heart of that issue.
I think it does. Thank you.
What about the ACL and student?
I'm sorry. This is not a conversation that goes between you and her. This is a conversation that goes between this audience and her with her questions. And I'm in between asking the questions. So I'd please ask you to respect that. I think we're done. Next would be Bill Hancock. I'm sorry, what? Okay.
I have something.
Okay, thank you. I have the same expectation of the audience.
Yeah, I know.
Okay, great, thank you.
This has touched on a very important issue. I started to enter this race when I saw an article on April 1. And as far as my reading, and I have it right here, said, hey, there's 3 positions open, we can control this board. Now, there has been an apparently, to me, well-orchestrated flow of letters in the paper, and I've got them all right here, which say specifically, put this group of people in and we have a voting block. We can control it. There's the talk of transparency and responsibility. I guarantee you, if you do put a voting block in like this, you will see what it is to lose those things.
Okay.
So,
all right.
No, I know this is important because this is out there.
I'm sorry. It's really not, because you're introducing factual information that this audience does not have at hand. Therefore, this audience can't be educated fast enough to respond to what you're saying.
I will pull back and say, please look at the letters. The problem here, this is a junior hospital taxing district. It is inappropriate for there to be any partisan association with a district that is supposed to have responsibility for provision to all people of basic services. Now, form your own opinion and take a look at it. But I will come back and say, a list of people, a slate of candidates is perfectly appropriate in any partisan race. It is not appropriate, in my view, and the view of a lot of people, in a hospital district race. And look again at the papers. Despite the claims, they are saying we can vote as a block if we get these 3 people.
I'm really sorry, but that's just so wildly inappropriate.
Well, it's the truth if you read the letters.
Well, it's the truth as you...
I'm sorry, I don't mean to be combative. I felt that this question opened it up.
Put the microphone down for a second. The audience potentially does not share the same opinion that you do.
Sure.
You have an opinion, you're absolutely entitled to the opinion. Others in the audience may have the same opinion, or they may not.
I'm just saying, read the papers yourselves.
Well, that's great. The problem is that just doesn't give anybody an opportunity to be educated as they're sitting here listening to you. So I'd really appreciate it if you just keep it to civil discourse.
Thank you.
And take the temperature down. There's no reason for it.
Thank you.
You're welcome. Okay, Jenny.
Yay!
Yeah, yay.
Yeah. Sometimes perception becomes the truth. And I think maybe what one of the aspects of the discourse up here might be being generated by is the fact that It is a nonpartisan race, and the Democratic Party came out endorsing Monica at her request, and Bill, and then Barbara didn't want that because she understands the fact that it's a nonpartisan race. And then all of a sudden the names appear on the signs, and there's a lot of confusion in people's minds about how that appears. Okay, and so I'm uncomfortable with it. I wasn't asked to be part of a group or something like that. I'm strictly running as an independent candidate for all of San Juan Island residents. That's my voting block. It's right there, every single person. And so I think there's a lot of information out there that supports some of the things that have been said here from this platform. I myself have spent a great deal of time being familiar with the issues, because it's incumbent upon me, if I'm elected, to know what to expect. There is a process afoot, regardless of what's being said, in order to bring a potential lawsuit against our hospital board. That's going to come out of taxpayer dollars. And that is a discourse, that's a discussion that needs to be had. And
well, that isn't a discussion that's a part of this question, so can we just kind of slide back to the question itself?
Okay. It was a multi-part question. Go ahead and give me the rest of it.
Does this indicate that you agree on the majority of major issues and intend to work on them as a block if elected?
Well, that was for them. Okay,
yes.
And I'm trying to, you asked me to comment on that.
Yes, I did.
So that's what I'm doing. These are comments. And so I'm commenting on those things. I cannot speak for these people. It's not my place to speak for these people. They have already spoken for themselves. But you did ask for my comment.
Indeed, and you've given it.
Thank you.
Thank you. Okay, that was fun. So let's get to something slightly lighter. This is for all the candidates. How many weeks a year on average do you reside on San Juan Island? Inquiring minds wish to know. Yes, that's right, I'm supposed to pick somebody on it. How about if we just make it easy? We'll start with Bill and go all the way down to Michelle.
365 except leap year, and 356 days. Every day. Every once in a while I get on a plane and fly over to the mainland, but I'm back that same day.
We have 2 dogs and 2 cats. We have to have babysitters if we leave. We live here full-time for 17 years.
We're full-time residents.
We have a vacation home in Oregon, and I don't know how much time we're going to spend there. I hope that we spend, my family's all in Oregon. I have 4 brothers down there, and it's the best way for me to spend time with them. So I'm going to spend time with my family, but my primary home is here on San Juan Island.
I'm a full-time resident. I do take vacations. Does that count? I'm allowed to take vacations.
I think it does.
Okay, good. Well, I do take vacations, but I'm a full-time resident. We only have 1 house, no vacation property, no other residents. Full-time, separate vacations.
Let's see, Bill, if I can top that. I've got about 30 sheep, 30 chickens. I've got a llama, a goat, big boarding kennel that would take care of your pets if you ever needed to go, by the way. I've been a business owner here for 10 years. We're full-time, and sometimes I feel like we're full-time and a half, honestly. So we love serving our community. My husband's with the San Juan Historic Museum, and we love our community.
Great, thank you.
Don't turn it off. Sorry, I thought I had the other one.
It's okay. We've shifted from the bad microphone being the blue band to the bad microphone not being the blue band. This is going to be the final question before we go to closing remarks. And again, it's got too many parts, so I'm just going to try and pick a couple and leave it at that. Emergency medical services is a necessity for islanders. However, the EMS levy has failed twice in the past. Part A, what is your understanding of the reasons for it failing? And B, as a public hospital district commissioner, how specifically will you help to ensure that the levy passes in 2016? And how about if we start with, who hasn't started? Barbara, I think you have not started.
Oh, I started.
Okay, well then I'll start.
I'll do it.
I'll do it.
Okay, the ACLU.
I think we're close to wrap up.
My letters mixed up. The EMS levy failed twice, and I think we have lost the community's trust, and it wasn't presented as a trustable, affordable levy, and we need to get that trust back. And the way to do that is we create a levy that is sensible and people that the voters will trust. And then we have to take it to the people and explain how this levy will work. And we have to engage in a very large education program. And I think we could look to the Island Rec program. They had a very successful program on their levy, and they had budget problems too. This education is, first of all, got to explain why the budget is sustainable, and I hope it will be sustainable. There's a new chief on board who I think are coming on board. He's not there yet, or she's not there yet. And I think that will do a lot towards creating this good budget, and then we've got to go out and explain it. And we've got to explain what the specific services are that we are all getting. It's not just the ground services, there's air ambulance, there's outreach programs. And I think we've got to use our people, our EMS people, to go out there, explain their equipment, how it's used, where, and show where our money is going. And I think we can do that, but it's going to take a lot of hard work, because this is not going to be a slam dunk.
Thank you. Monica?
Sure, I agree with Barbara in that I think the reason the levy failed is that people didn't trust the budget, or they didn't trust the process. And that's a failure. But we can overcome that. To me, the way that you earn the community's trust and their support for this budget is you take it through a very thorough vetting process. So we're going to take it through a very thorough vetting process, and we're going to invite people from the community to come with their comments, to come with their suggestions, etc. We're going to look at comparables. We're going to see what it takes to provide the type of service that we should all have. It's a really crucial service. And the question is not whether we should have it or not, but how do we do it affordably and at the right level, so that the right level of funding, so that we can get the type of service that all of us expect. There's some interesting elements that come into play. I've talked to a lot of people who are very confused about things like air transport and what the options are. I'm an instrument rated pilot. I understand some of the concerns. I know why there was the desire to get a plane that could go into icing conditions. These are some things that we could talk about, but really what needs to happen is a very sharp eye and a sharp pencil needs to be taken to that budget. And then, once that's done, then all of us, I think, are going to work very, very hard to make sure it passes.
Thank you. Michelle?
We were just saying Barbara should have used that phrase. Yeah. She's got a great name for campaigning on to get that. But we went to the table early, People had an option of, well, if this doesn't pass, we'll catch it later. We did it in a recession. People didn't want to part with their pennies early. This time it's going to pass. I feel very confident. I've had experience working with living language. I've had my medical experience will be able to allow me to better communicate with you as to what those EMS needs are going to be and why we need that specific amount. Other things to watch for is whether we're going to look for a permanent levy or one that will keep coming through on a cycle. So I have the experience to work with that, and I plan on passing that levy.
Thank you. Microphone down here for Bill, then we'll do Bill, and then we'll finish with Jen.
I think Monica gave a really good answer about the process that we're going to have to go through. The first one, I don't know if you mentioned that one of the things they're working on right now is getting a new EMS chief. And I think that's going to be very critical. The credibility of a chief who is believable, who will work toward the preparation of a budget that's based on an actual workload, that can talk about the various programs and put those forth. That's an important part of the process. Documenting the budget based on the services that are actually going to be rendered. The process of budgeting can be broken down in a zero-based budgeting process that works up from you start with nothing and build your budget based on each increment of service that you put in, each group of people that it takes to run those services. Once that's been put together, then I think the commissioners need to be read in on that. The commissioners generally are not going to be the budget experts, but they're going to have the knowledge to overview what's being presented to them, and they're going to have to ask the tough questions. In all the budgeting processes I've been in, that questioning part is a very big part of being sure you've got something that you can sell. And then I think the commissioners turn around and work with the EMS folks to get that message out to the population that this is a trustable budget, this is a thing that should be supported. Everybody here has said the EMS budget will be passed. Everybody here is willing to work on passing the EMS budget. One of the main things that we want to be sure about, though, is that we're all willing to work on being sure that it is a sustainable EMS budget. Well, one of the questions that's going to come up in this is whether it's going to be a permanent or whether it's going to be a shorter one, and that will be something we'll have to decide.
Thank you. Bill?
I agree with Bill. We don't set EMS policy, but we are responsible for looking at the PR. The levy failed before because of a very poor and inadequate PR effort. Now, the EMS people have not been sitting back since the levy failed. I have here a catalog of what they've been doing. They've been taking salary cuts, 8%. They've done all kinds of things, totaling up to almost $300,000 in decreased costs. That's important. You're right, the new chief, that's the guy that has the experience to write the budget. We have to look at it and then say, is this something that people can understand? Now, I've ridden ambulances as a doctor. I have been in charge of a large ER in San Diego. I don't presume here to tell these people how to run their show, but I certainly am ready to work with them and particularly look at the PR effort that needs to happen. And I'm optimistic about it. Because I've also read what happens if the levy doesn't pass. It's scary. You won't have highly trained people in the emergency ambulance. I agree, it's not going to happen, but these people are working on it right now, and we can be confident in them.
Thank you, Bill. Jen?
I'll
believe the question was, what are our opinions of why the levy did not pass? Is that correct? Is that the question?
Number one is, what is your understanding of the reasons for its failing?
Sure.
And number two, what will you do
Sure.
to ensure that it passes?
Well, I've been fortunate this year because I was asked to come inside the EMS and work for several months on some internal issues. So in doing that, I did some in-depth interviews. Was going to do it with about 9 people. I ended up interviewing 22 people, anywhere from an hour to 3 hours apiece. So I am very familiar with what's going on inside and also about the externals. And some of the things that I found, so this is kind of, you can't say straight from the horse's mouth, but it's collectively from the horse's mouths, okay? One of the things that I want to say right up front is the failed levy was not and never was from this community a referendum of lack of confidence in these people. We all know the value we have in the people that show up at our door when we meet them. It is never a referendum on our good EMS and paramedics. What there was out in the community is role confusion. Role confusion. You have a hospital board. You have a hospital, public hospital district, has the word hospital in it. People don't know the difference between the hospital board and the public hospital district. They don't understand the difference between the public hospital district and their role in the healthcare and the Board of Health and Health and Community Services. And on and on and on and on. And here you are asking me for money in a recession. And oh, by the way, you want more than you had the last time and make it permanent. That creates problems in people's minds. So first you have to do is help people with understanding the structure. And then you have to understand and answer the question in their mind, why do I have to pay more money or should I pay more money? Okay? And then you have to be able to take it to them in a way that is understandable to them. There was also a problem in the way the referendum was worded on the ballot.
Thank you. Okay. We're now at that time in the program for closing remarks. Each of the candidates has 2 minutes. And please, we're all kind of at the end of it all, so please get 2 minutes. Now we'll start with Bill, and because we started with Michelle, we will end with Michelle.
Well, thank you all for being here. It was, whoops, got the mic. This doesn't look like a big room, but anyway, thanks for being here and for presenting your questions. This is an opportunity for us to communicate to you where we stand on issues. Hopefully you'll be able to see some differences, and that'll help you make your choices as to who you want for your commissioners. I said in my open remarks that I wanted to work for the sustainable, well-managed EMS. That is true. I want to assure that the district complies with the laws as they're written, particularly the Women's Reproductive Privacy Act and the Death with Dignity Act. I want to be sure that our tax money, that I understand exactly how the whole process works so that I can explain it to anybody that asks me how it works. I want the relationship between the community and the hospital district to move to a point where the community feels that the hospital district is considering all the healthcare needs that this community has and taking a look at which of those needs or what of those needs that the hospital district can help support. And part of that, of course, is Peace Island. They are a major part of that, and that is one of the items that the district has to always consider as well. The air transport providers, I touched on those to begin with. I definitely want to be sure that we maintain really good relationships with both of those because I know that we need both of those types of air transport. This island is a place where a lot of our health care is going to be delivered through emergency transport, and we have to have that part work well. So thank you.
wife smiled when she heard closing remarks, because I told her, I looked at the announcement, I didn't see closing remarks. So what? I am excited about the opportunities that we have here and these things that I mentioned to you, Veterans Choice, EMS paramedicine. I am going to bring to the board a unique combination of medical training and managerial experience. I have, as I've said, I've done an independent campaign. I'll continue to do that. There's a whole lot more depth to everybody's campaign platform and standing. I have some brochures back there. I think you've seen them. Who's Doc Hancock? I enumerate that in much more detail. And also go to my website, www.electhancock.com. This has been actually fun, and thank you for coming.
Y'all must be good for me because I'm feeling better.
Thank you for coming.
Good. Wasn't fun the first go-on. I want to share with you what my vision is for healthcare on this island. I'm a creative problem solver and implementer. I can see, in working with the hospital Board of Commissioners, doing some of the things that we've talked about, but in more specificity. I have a plan for how we can manage that money that is missing for the in-betweeners of the indigent care and the people that have full care. It's a program where we know how generous we are as a community. If you went to the Terry Ogle event and the astounding money that was raised, I was so happy to be there and see that happen for him and see them on the television. But I've got a dear friend down the street that has lung cancer, and she's a lovely person, and she just deserves to have support also. And so I don't think we should do less for Terry. I think we should do more for others as well. And so I'd like to see us as a community put together a Save to Share program. And I have a template for it, and it'll be an easy thing for us to do, and it will be administered in a fair and equitable way so that it becomes a bridge and a resource for our community, for the people who have high deductibles and their finances are where they can't meet them, that they can tap into that money. And so we continue to do the good things for like the events for people that we care about and show up and raise money. But this will reach the people who are kind of in the sidelines and things like that. And that's a good thing. I also have creative ideas about how we can use our EMS in other productive ways. We're doing elder care service now. I have a great idea. Why don't we, I talked it over with some of the people out there, put together a loaner medical alert necklaces and bracelets for people who go home from hospital care that they have no one to check on them, and they can feel secure because they can press that button. And I have other good things that will be on my website about my vision for healthcare, and I hope you'll consider voting for me November 3rd.
First off, thanks again so much for everybody coming out. It's really exciting that so many people are so interested in this race. It's a great thing. It's a really great thing. And I want to work hard to solve some of the problems that we've talked about. I want to make care more accessible, both on a cost basis. I want to make sure that reproductive health services are available and supported. I want to make sure that the 75% of Islanders who voted for death with dignity have a real chance of being able to access death with dignity when they need it, and also be treated with respect, with good, accurate information about that. These are things that I'm passionate about because they make a real difference in people's lives. And it's been this whole experience of going out, having coffee in people's rooms, the forums that we're having. These have been wonderful opportunities to hear from people what's on your mind. That's wonderful. I'm looking forward to applying that. And the other thing I'd say is please go to look at San Juan Islander. leaguewomenvoters.com. Look at how we answered the questions. Go to the League of Women Voters Forum. Look at the answers to the questions there, because there are real and substantive differences between the candidates, and it's important that you understand those. Thank you. Thank you all for coming, and thank you for your very insightful questions. And again, thanks to the League of Women Voters for again putting on this yearly forum. As I said before, I think my legal experience and training, plus my community experience, are invaluable assets that I intend to deploy absolutely as a commissioner. And I will work to provide all islanders with the best possible range of health care, delivered efficiently and in compliance with the law. And of course, affordable care is something I feel passionate about as well. And I will also say that I've been endorsed by the Planned Parenthood Votes Northwest, and I firmly support our local Planned Parenthood office here in Friday Harbor, even though they only open one day a week, because they provide essential, affordable medical care that people on the island cannot get. And lastly, I will never be satisfied with the status quo. There is always room for improvement. We have a wonderful system, we have wonderful programs at Peace Island, but there's always room for improvement. I'm rational, I'm pragmatic, and I'm dedicated to following the law. I'm also will firmly act, speak, and write professionally. And I ask for your vote on November 3rd.
I'm Dr. Michelle Loftus, and I would like your vote on November 3rd for position 2. The requirements for this job fit my experience like a glove. My business experience will help me to fiduciarily be responsible with your tax dollars. As I mentioned, veterinarians know how to make those pennies scream. I'm good at that. My managerial experience, I've managed employees. I know what it's like to manage medical employees. We have a higher rate of stress dealing with issues that are life and death, literally. So I have really great managerial experience. My political experience will help me to help write that levy. It will help me to do the PR campaign that's going to take to make that pass. And I just have to mention my administrative experience. I've been part of corporate and private hospitals that have come upon numerous issues that we all seem to work through. I represented labor at one point in time, and everybody came out happy. So I want to do that for our district. I want to spend your money efficiently. I want to recognize those upcoming needs that are going to be facing us. And most of all, I just want to serve you, my community, my neighbors, my friends. So vote for Michelle Loftus, position 2, November 3rd. Thank you.
And let's give the candidates one more round of applause. And I'll now turn it back over to our League of Women Voters President, Clark Helm.
Thank you so much for coming, and thank you, candidates, for being willing to run and serve your community. I'm impressed with all of you. Just a few words, if you'd like to know any more information about the League, we have information on the back table. There were a couple of clipboards going around. If you didn't sign up on one of them and you would like to, please do so. We're done with this forum, but we're off to Orcas tomorrow and Lopez the next day for their forums. So we enjoy doing that every year. So thank you for coming. Good night.